The reason I got into ophthalmology is because I like working with my hands, and it was a surgical subspecialty that interested me. I went to the University of Virginia. I was in the first class of women undergraduate, then went to Medical College of Virginia, then went to Emory and Grady where I did my residency, and I did 2 fellowships. One at the New England Medical Center in Boston, did a cornea fellowship there, and then I worked with a surgeon in Atlanta for a year who was one of the first surgeons to do implant surgery back in the 80s. The great thing about ophthalmology that I didn't know about it when I first started out is that you really have to listen to your patient's interests, hobbies, professional, day-to-day activities so that you know how to best take care of them. When I first meet a new patient, I try to listen to them why they're here to see me. What can I do to help their visual needs? And this usually means an interview that getting to know the patient beyond just superficially, what do you do? If you're an architect, I need more to know, well, do you work on hard copy? Do you work on the computer? How far away is your desk? I need some details about the patient's activities, whether it's professional activities or their hobbies. I try to reassure patients that the procedures we do are very safe, have a huge success rate, very high patient satisfaction rate, and anything I can do to make them comfortable, I will. The technology has just surpassed my imagination. If you had told me that we could make a flap on the human cornea, which is only a ½ millimeter thick, if you had told me that 30 years ago, I would have said you're crazy. And here we are, we do it routinely now. We not only do it, we do it in many different ways. One of the good things about getting on in years is the experience I've got now. There are very few things that are a surprise to me.